Hi everybody, we're going to talk about the cardiovascular system for this lecture. I want to be sure to say, I'll probably say it several times, but all of our guests who come in and talk about pharmacology, all of their material is up for tests for quizzes and exams. So I'm going to, whenever we have a guest, I'll be focusing on sort of the systemic system and then the overarching view of the diseases, but then we'll have a guest come in several times to actually go over medications. So all of that material is going to be up for grabs for exams, so make sure you study their PowerPoints as well. Okay, so these are our objectives. Students will discuss the etiology, pathophysiology, clinical signs, and risk factors for the following cardiovascular conditions. We'll go over hypertension, coronary heart disease, angina, and congestive heart failure, and then we'll explain a little bit better, or a little bit of the role that cholesterol plays in heart disease as well. So what are the functions of the cardiovascular system? The cardiovascular system is a very complex system that functions to supply blood and oxygen to the body through contractions of the heart and the vasculature. So when the body demands more oxygen in one area or the other, the vasculature either will expand or contract in order to direct that blood flow to where the oxygen is most needed. So the system is comprised of the heart and the connected blood vessels. There are many functions of the system, such as circulating oxygen, but also removing carbon dioxide. It provides cells with nutrients and protects the body against disease and infection. The system also initiates clotting when an injury has occurred. It removes waste and transports hormones or drugs or chemicals to various target organs throughout the body. So it does all sorts of stuff. So what would cause the system to fail? Well, the main things that would cause the system to fail would be if the heart's not contracting and pumping, if it's not doing its pumping mechanism, or if it has some kind of a blockage and oxygenated blood flow doesn't get to a certain part of the heart, and then that part of the heart could die. And when there's a blockage in the blood vessels, we call that atherosclerosis. So the various disorders that we'll talk about include hypertension, heart disease or coronary artery disease, angina pectoris, and congestive heart failure. So let's discuss hypertension first. Hypertension occurs when the pressure in the arteries is elevated for a long period of time. This is caused by the volume of blood in the vessels being more than what the vessel can hold or what space is available to hold the volume of blood. The force that is applied to the walls of the arteries is the measurement you get when you take someone's blood pressure. So when you take someone's blood pressure and it's 123/74, those numbers actually represent the amount of pressure or force against the walls of the blood vessels. According to the American Heart Association, we have some numbers here. Little over 100 or just under 120 million adults have high blood pressure. 81.5% are aware that they have high blood pressure, so that leaves roughly 20% not being undiagnosed. And about 50% of patients with known hypertension who are on medications are not adequately controlled. So it takes a while sometimes to dial in the medication just right to control blood pressure. This slide was in this slide deck previously, but I kept it in because I love this movie. I think this movie WALL-E, I don't know how many of you have seen it, but it's super cute. But it kind of highlights some in sort of a satirical way, a satire that are the risk factors that contribute to high blood pressure are sedentary lifestyle, inactivity, eating all the bad foods that taste so good, obesity, lack of moving around, physical activity. And according to the CDC, high blood pressure was a primary or a contributing cause of death for more than 500,000 people in the United States in in 2018. So just under 500,000 people, blood pressure was a contributing factor or a primary cause of death. And then high blood pressure costs the United States about $130 billion each year, and that was averaged over a 12-year period from 2003 to 2014. So let's review the receptors. The blood pressure is regulated by the sympathetic nervous system, and of course this is our adrenergic receptors, so alpha and beta, and also the kidneys as well. So which receptors regulate blood pressure? So what's this one representing? This would be your alpha-1 receptors located on smooth muscle tissue and produce smooth muscle contraction blood vessels. That's what we're focused on here. Vasoconstriction and of course increased blood pressure when it's initiated. Beta-2 receptors are located on the cardiac tissue and they increase heart rate and contractility. So beta-1 receptors are located on the heart muscle, and then it's affected by heart stimulation and renin secretion, and renin secretion comes from the kidneys. So that's why the kidneys are a big player as well. So as the body demands oxygen in certain areas more than others, the blood vessels will either contract or dilate to direct that blood to where the oxygen is needed. So if you think about if you're working out and your muscles and your lungs are demanding oxygenated blood, your stomach blood vessels might contract a little bit and blood flow might be reduced to, say, your stomach because it's not needed there as much as it's needed in your heart or in your lungs and your muscles. So hypertension is when the force of the blood pumping through those arteries, though, it's too strong and it's too much pressure against the walls of the arteries. And the factors that influence blood pressure are cardiac output, peripheral resistance, that's the resistance on the blood vessels, and then overall blood volume. So the blood vessels will, so if your heart is not pumping, so with the cardiac output, if your heart is not pumping effectively or not pumping enough blood throughout the body, that will affect blood pressure, but then also your overall blood volume, how much blood you have in your whole body. So a lot of times some of our blood pressure medications are to reduce overall blood volume or overall liquid increase. That's what the diuretics do, is they help eliminate liquid from the body, so that is also helping to decrease the pressure on the blood vessels. So that helps to lower blood pressure. So this, I realize, is an incredibly complex looking figure, and you do not have to memorize it, but there are some really important aspects that you need to know. I highly recommend you watch this really nice simplified video that makes this whole thing seem far more straightforward. The really big points to take home here, and this is reinforced in the video, is that there's lots of different areas in the body that affect blood pressure. There's lots of different systems in the body that affect blood pressure, and we have different medications that come in at different places to affect the blood pressure. So we have ACE inhibitors, and we have calcium channel blockers, and we have diuretics, and we have just all these different medications. And this sort of helps you to put all the pieces together and kind of understand. But what this is basically talking in a nutshell, and I'm not going to explain it nearly as clearly, that this video does a better job. But our liver produces a hormone called angiotensinogen, and that is going to be converted to angiotensin-1 when it combines with renin from the kidneys. So renin from the kidneys comes out, the two of them come together, make angiotensin-1. Then the lungs, we're going to get this angiotensin, what's this called? Something enzyme. I can't remember what the C stands for, but it's basically, they call it ACE. It's an enzyme that comes together with angiotensin-1 and creates angiotensin-2, which increases blood pressure in a number of different ways. So this is circled to help you realize this is where the ACE inhibitor comes into play. So if somebody's taking an ACE inhibitor, they're stopping this process right here. So now if they're not taking an ACE inhibitor, angiotensin 2 is going to do a number of things. It can kick up your sympathetic nervous activity. It can affect the reabsorption of sodium, calcium, potassium, which has a lot to do with fluid retention or water retention. It will act on the adrenal gland and create I don't say this word very good. Aldosterone. I don't think I said that very good. But that increases blood pressure because it increases sodium reabsorption, which increases fluid retention, which is going to increase your blood pressure. It also acts on the kidneys. Angiotensin 2 acts on the kidneys as a vasoconstrictor, which is going to increase blood pressure. And then down here, this one, I'm not 100% positive. Obviously it acts on the pituitary gland, ADH secretion, which collecting duct, water absorption. This also obviously has to do with fluid retention, fluid resorption, and probably overall fluid volume, which will affect blood pressure. So you can see there's all these different areas that from different systems that can affect blood pressure. So it's a very, it's kind of and they call this whole system RAS, Renin-angiotensin-aldosterone system, RAAS. And it's the activation of this system is primarily governed by the kidneys, and it's the most influential system in regulating blood pressure. Okay, so I do encourage you to kind of look at this, be familiar. I do want you to know about if you want to reduce fluid, I do want you to be very aware of this. If you're looking to reduce overall fluid retention, you need to kick out some sodium. So that's, you need to get rid of some excess fluid in the system. And so that would be having to do with the sodium reabsorption. If you want to, and then also we need to know, you need to be familiar with, I have to look it up here really fast. I hope I can find it really fast. It's the potassium reabsorption medications. I want you to look that up. Potassium sparing diuretics. So the different kinds of diuretics. There's the potassium sparing diuretics, and then there's the sodium. There's the loop diuretics. And I want you to be familiar with that, knowing that the potassium sparing diuretics act in the distal tubule, where inhibition of sodium reabsorption results in a corresponding reduction in potassium excretion. So it's basically inhibiting sodium from being reabsorbed, which is going to inhibit the overall fluid volume from being up. Because remember, like you'll see in this video, where sodium goes, so goes water. They kind of travel together. So whenever we're controlling the amount of sodium, we're going to decrease blood pressure. I know this is very complex, kind of convoluted, but hopefully I made some sense there, but do watch that video. So 90% of all people with hypertension have no identifiable causes, but we know there's a lot of risk factors. We know there's risk factors with obesity, smoking, excessive alcohol intake, excessive dietary sodium, and physical inactivity. These are all areas that people can modify, modifiable risk factors. And for treatment for hypertension, there's pharmacotherapy or, prescription medications, and then lifestyle modifications. So again, pay attention to the talk from Dr. Beggerts, because the medication he's going to go over will be on your exam and quizzes. Heart disease accounts for about 40% of all deaths in the United States. It's the leading cause of death after age 65. And there's some more information here at this goredforwomen.org. And we're going to talk a little bit about coronary artery disease. Atherosclerosis is the thickening of the internal layer of the arterial wall caused by an accumulation of lipid plaque. So you can see how the lumen starts to get smaller and smaller, and it starts to get kind of pinched off there because of the buildup of plaque or buildup of lipid plaque or lipoproteins or cholesterol, I suppose. Results is diminished blood flow and oxygen supply to a portion of the myocardium. So it's not going to allow blood flow to get to a certain area because it's going to be kind of pinched off. So we'll kind of briefly explain lipids, lipoproteins, triglycerides, and cholesterol. Okay, so lipids are fats, and they are important in the diet because they help the body absorb vitamins, and cholesterol is also an important part of cell membrane, and it's a precursor to steroid production in the body. So all of these things, so fats are not a bad thing. There's so much information about interesting information about what happened when we took the fat out of all of our food and just added sugar, and how that didn't help anyone be healthier. So I always feel like fats sort of get a bad rap, but they are really super important in our diet. However, they are insoluble in the blood, so they are transported in the blood in the form of lipoproteins. And then lipoproteins are complexes contain different percentages of triglycerides, cholesterol proteins, and phospholipids. And that is, and I'll talk a little bit more about that in the next slide, but that involves the low density lipoproteins, the LDLs and the HDLs, that sort of thing. So triglycerides are all synthesized by the liver, and then cholesterol mostly obtained from the diet, but also is made in the liver. So those are a couple just little important things to note. I did want to say, though, back here when we were talking about coronary artery disease, it's important to know that almost half of deaths occurring from coronary heart disease are due to high cholesterol and lipid plasma levels. So this is a major factor in heart disease. Okay, so here's our lipoproteins. So hypercholesterolemia or hyperlipidemia is characterized by an increase in both cholesterol and triglycerides, respectively. But there you can see here that we have some that we call good and some that we call bad. So we have these different types. We have the very low density lipoproteins. These are triglycerides and cholesterol that are transported in the blood in the form of the very low density lipoproteins. Then we have LDL, which is called the bad cholesterol. It's the highest amount of cholesterol is carried by LDL. And then there's the good cholesterol, which transports cholesterol to the liver, where it's eventually removed from the body. So this kind of helps you process it. So if you have high amounts of the HDL, you're going to kind of be an effective cholesterol metabolizer. If you have high levels of this LDL, not so much. So there was a panel of experts, and they agreed that elevated LDL, so elevated low-density lipoprotein cholesterol, is the primary target of cholesterol-lowering therapy. So when somebody takes a statin, they're trying to lower the LDL. And this just shows some different, the triglyceride, the phospholipid, the protein, how the fat molecules are made up of different parts. So a high cholesterol level, hypercholesterolemia contributes to the development of atherosclerosis. So here's your HDL, your LDL, and your very low lipid, and they each consist of a different proportion of these triglycerides, phospholipids, proteins, and cholesterols. So this is the good one, and you can see that it has more. Let's see, what color is that? Is that the protein? It has more protein and the littlest amount of triglycerides, where the very low density lipid has the most triglyceride, very little protein, very little cholesterol, and very little phospholipid, and then a ton of cholesterol, or a ton of triglyceride. So this is the one that you probably wouldn't want that much of. I'm going to skip this slide. You don't have to worry about this slide at all. And this is just showing sort of how the plaques build up in the lumen of the vessel, moderate narrowing, thrombus partially occluded, completely occluded. This is showing how a complete coronary arterial occlusion can cause death or an infarct of the tissue here. So you can see this is where there's a blockage and there's no oxygenated blood getting to this part of the heart. So increased risk factors for heart disease are being a male, being over 65, having a family history, having high cholesterol, hypertension, cigarette smoking, inactivity, obesity, diabetes, stress, and depression. These are all kind of, for the most part, potentially modifiable risk factors. Obviously, family history and older age. I suppose modifiable is not, and you can't modify, well, they're not modifiable. I spoke wrong there. Some of them are, you know, obviously smoking, physical activity, obesity, and stress levels you can try and do, and then some of them you can sort of are in a middle ground. Diabetes, sometimes you can work with lifestyle, and depression, you can also do some things to sometimes help with depression, other than it's not necessarily something you have to live with forever. And then hypertension and hyperlipidemia as well. These first three are not modifiable though at all. So treatment, reduce risk factors that you can reduce, pharmacological management, so medications, and then revascularization, there's treatments, angioplasty, stenting, and coronary bypass. And these are some resources you can look at if you're interested in more information there. And then these are just some images of like a bypass, angioplasty, and a stent being placed. Congestive heart failure is the most common diagnosis amongst Medicare patients. Heart failure is primarily a condition of the elderly, and about 5 million people in the United States have heart failure. So this slide, sorry, is sort of out of place. I meant for this to be at the end of the congestive heart failure, but we'll just talk about it now. So angina pectoris is a condition when blood flow is decreased and the demand for the oxygenated blood flow is increased, and the outcome is this ischemic pain that they call angina, and it can feel very much like a heart attack. So when people first have angina, they may go into their doctor and say, I'm having a heart attack, and then they eventually get diagnosed with either stable or unstable angina, and they can take medications to kind of help dilate and give them more oxygenated blood flow. One of the most common medications for somebody with angina pectoris are the nitrates, nitroglycerin. So I want you guys to know that for upcoming quizzes or exams. Any conditions that cause myocardial necrosis or produce chronic pressure or volume overload and myocardial dysfunction, that's what contributes to congestive heart failure. It's an inability of your heart to function as a pump. It's not pumping well. It's not doing its job anymore. And some causes can be long-term hypertension or heart disease. But heart failure occurs when there's decreases in contractility, so the heart's not contracting, preventing the heart from pumping forcefully enough to deliver that blood to the part of the body where it's needed. Decreases in cardiac output activate reflex responses in the central nervous system, which attempt to compensate for the reduced cardiac output. And such an increase would include things like heart rate or increased preload. Look, you can look up what the definition of preload is, but the increased preload will increase edema in the body. And then also this if all of this is going on for long term, eventually the heart will fail. So some signs of congestive heart failure are perceived shortness of breath or dyspnea, exercise intolerance, fatigue, edema, either pulmonary edema or fluid collecting in like the lower legs, weight gain or increased size in the abdomen, like if the abdomen is distended but there's not a lot of fat anywhere else on the body, but there's like a distended hard belly, that it can be a sign of congestive heart failure. And here's an image of edema. You push on the skin and the indent stays, and that's because they've displaced fluid. So that's a telltale sign of congestive heart failure. So treatment to treat the underlying medical problems such as hypertension, atherosclerotic heart disease, or diabetes, and then behavior modification with smoking, weight control, exercise, and these other ones here. So I want you to look up these, answer these questions for next week. This information will be on future quizzes and exams. So what type of cardiac medication can cause gingival enlargement? You need to know that. What type of cardiac medication can cause a lichenoid reaction of the oral mucosa? What is a lichenoid reaction? How many cartridges of local anesthetic can be safely administered to a patient with a cardiac condition? So look up all those and have answers for next week.